Good afternoon, everyone. My name is Victor. Today, I will talk about falls and falls injuries prevention and health promotion for older people. So let's come to the introduction. Population aging is one of the global health challenges. Falls and falls injuries are the common issues among the old people at 65 and over. Falls prevention and health promotion are very important to older people. We come to the falls. Falls can cause hips, arms, legs fractures, head injuries, even death. Falls can lead the older people lose independence, just like people use the wheelchair and this assistant with the equipments and are supported by the other people, increasing the medical costs and also death. And social economic burdens and health expenditure need to be aware of because they increase. So the cost is the problem, the issue for the older people and also for the family, community, and the country. So we look at the statistics. In 2012 to 2013, the number of injuries due to falls sent to the hospital was about 100,000 people in Australia. Falls increase with ages increasing. We look at this finger. The age of 65 to 85 pass, and we can see the falls increase with the ages increasing. Yeah, the yellow one is the women, the blue one is the men. The gender difference, maybe the women more easy to get fall than men. The reason of falls include poor muscle stress, weakness, balance problems, sensor disorder, for example, the poor vision, hearing a peripheral neuropathy, just like some impaired, postural hypotension, inappropriate footwear, household clutter, too many or inappropriate medications, urine incontinence. So it's very common for the people during the night wake up and go to the toilet, maybe blocked by some carpet or chairs on and have the fall. So the reason of the falls, it seems to be very complicated. For example, the medical issues cause the fall. So we need to pay more attention to the people themselves, to empower themselves and let them more stronger. So we need to focus on the stress and balance for the self-improvement and empower. So we look at the overview. The settings and supportive environment approaches for falls and falls injuries prevention and health promotion for the older people. So use the setting and supportive environments approaches. Include education, health information about the falls and falls injuries. Provide education. Education is the center of the health promotion. We know that, okay. Exercises and strength training for the older people focus on the strength and balance. Building the aging environment building the aging-friendly environment, changing unhealthy behavior, including the active lifestyles. That's the very important. The people, they don't move. They don't want to do the physical exercises and improve their health. And building the health city and communities and homes. So this is the settings and supportive environment approaches about. And let's come to the case study. Force and force injuries prevention programs in ACT. So first we look at the challenge of the force and force injuries in ACT. Between 2005 and 2006 and 2014 and 2015, this period of time, more than 1 in 5, about 21.8% older people at age of 65 and over reported falling in the last 12 months. Among them, 49.3 fell more than once. That the 49.3% of the people among them, they have the falls more than once. And 22.4% were sent to the hospitals as a result. Because they have the fall, they call the ambulance and sent to the hospital. And about 1/4, just like 26.5% of the fall-related hospitalizations for older people stay at hospital for 8 or more days. The rate of fall-related hospitalization for older people at that period of time increased 40%. Comparing the total rate of the hospitalization for the older people rose 32% at the same period of time. So that means the people, have the fall and sent to the hospital. They still increase, the number of the people they increase. So this is the challenge, the people, for the older people. So we look at the implementing force and force injury prevention program in ACT. What's the program about? So the policy, just like to work with the individuals and community organizations to raise awareness of force and force prevention in older people. So for the mainstream, maybe 65 years, and the Aboriginal or Torres Strait Islanders person over 55 years. They're a little bit different, right? The ages. The service includes prevention and early intervention, local community education activities and resources, individual advice, information, education programs for medical and other healthcare staff. Stepping on, this is a community-based education program for the clients over 75. So all the services for the Medicare holder and silent seeker, just like the refugee, they all free. So this is the free programs for some people. They're eligible for the free services. So the Medicare and the refugee, well, just now we mentioned that. So the programs strengthening the case move beyond aerobic exercise. So they making the health public policies according to the physical activities guideline, including Australian and and other country and the World Health Organization. Strength and balance activities are key components of the physical activities guideline. Strength and balance can prevent falls and reduce falls-related injuries among older people. They become more strong and empower themselves, and then they can manage themselves and control themselves. This is the health promotion need to do. And the health promotion empower the people, encourage people participate, and about the equal access to the services. Just now we mentioned the free for the people, the Medicare and the silent seeker. And educating and training individuals and groups at homes and community centers by qualified facilitators. They have the class, training class, and also they can have the individual support, the physiotherapy to give the advice and information and teach the people at home to do some exercises and training. And monitoring and evaluating the progress in stress and balance activities, education and training class. So that's what the programs they can do and what they do. And for the ACT, they just building the healthy and age-friendly city for the Canberra. What's the healthy, age-friendly city about? It is about recognizing the diversity of needs and contribution of the people of all ages and abilities, and supports everyone to live an active, productive, and healthy life through considering the rights of all and the necessary infrastructures and services. So we can see what the ACT government has done include the master plans for the town and group centers. We can see the Belconnen and Gangalen, this town center. They're more suitable for the different ages to use their facilities. And planning urban renewal. We can see the light tree and some building along the Northburn Avenue. They're just changing, building some house to more suitable for the older people. And incorporating active principles into the ACT key statutory planning documents. When they planning develop the country, they need to put the principles in the plan, just like keep some green space for the people, more space, and more activity facilities, and implementing active travel infrastructures upgrades and open space improvement in some suburbs. Maybe in some suburbs we can see for example, the Ansley or Dixon or Turner or something. They're just doing that. Creating healthy paths, healthy people policies. This is the very good policy for the people live in the city. They can enjoy the nature, the green space, and the physical activities. They have a lot of the facilities, give the people to use and improve their health. Okay, let's come to the challenges for the health promotion practitioners. So the challenge include the falls and falls injury increase with the ages increasing, and the aging population grows rapidly. So this is the global health problem, but also this is the problem for Australian, for ACT. This is a challenge. And the causes of falls too complicated. They include the medical issues, very complicated medical issues, but what the people themselves, they can control themselves, they can manage themselves, they just improve. So although there's the challenge, the force, the causes of the force, and the gap between the complex needs and availability of the healthcare services. So the people, the high demand for the services, but the services is limited, and lack education and training for falls prevention for the practitioners, older people and their family. So some people, they need the new knowledge, but the education and training still very limited. So the effective individual for the exercise and strength training, so the assessment, so how to see what the outcome for the exercise and strengthening, and how to assess this is the effective the individual for the exercise and strength training. And age-friendly environment need to be improved. They're still improving, but the burden, the stress, and the pressures from the high need. So this is the challenge. Holistic approach and collaboration of the practice with the stakeholders. So not only focus on the one thing, maybe all the things as a whole. To think this is the challenge for the whole, the whole things, and the effective monitoring and evaluating the progress of the stress and balance training. So this is the very, important to see what's the outcome for the training. So the high demand for the training, the pressures from the monitoring and evaluating for the progress. This is the challenge. Okay, we come to the opportunities for the health promotion practitioners. So we often said the challenge, on the other hand, means opportunities. So we look at the opportunities for the health promotion practitioners. So they can have the education and training for the new knowledge and skills. And also the new technology for equipment utilization, for falls and falls prevention. For example, we can see that the people need to install the handrails and in toilet and bathroom, and prevent the people to get falls. And also this good opportunity for the physiotherapy and occupational therapy professionals. They have a lot of the training class, instruct the people to do some exercises. So this is the opportunity for the therapy. And allocating resources for falls and falls injuries, prevent and health promotion. The prevention and health promotion, they need some funding. If they have the funding, they can provide the services. So this is an opportunity to apply for the funding from the federal government and ACT governments and and the other state governments, something like that. And physical activity guidelines change the practice patterns for falls prevention for the older people and create more jobs for health promotion practitioners. So they have the different needs, and and they have the different resources, and they need more people to implement the plans, the programs. So this is let the people have more opportunities. So we can just like we know the falls and falls injuries prevention programs and the health promotion. The most important for all this just to encourage people participate in their physical activities and empower them and give them the equal opportunity to equal access to the services, just like provide the free services for some people that are eligible for the program. So this is the falls and falls injuries prevent program and health promotion for the older people. Okay, let's come to, this is the reference. Okay, that's all for today. Thank you. Bye bye.